In his recent speech to the American Medical Association, President Barack Obama said a single-payer healthcare system works, quote, pretty well in some countries. Several Republican senators who spoke to CNSNews.com on Capitol Hill disagreed with the president, while Democratic Senator Jim Webb did not take a position. Shadow Senator Paul Strauss agreed with the president, citing the United Kingdom and Canada. President Obama said in his recent speech to the AMA that a single-payer healthcare system works, quote, pretty well in some countries.
Right.
Would you agree or disagree with that? And if so, what countries do you think it works well in?
Well, I mean, obviously that was the president's statement, so he'll have to tell which countries he had in mind. But I'm not in favor of a public plan option in the healthcare plan this year for a couple of reasons. We've got two great public programs, government healthcare insurance programs, Medicare and Medicaid. We're at a time when the federal deficit is going out of sight. I don't think we want to start another government program that is going to end up costing the taxpayers a lot of money. Besides, there's a lot of competition in insurance now, and people therefore can benefit from it without us getting into another government-run health program. Frankly, the third thing, or maybe it's the fourth, is that if you put a public plan option in the healthcare reform proposal, it probably kills the whole proposal. And this is the year to get this done.
I don't think I agree. I don't agree. I don't believe they work very well at all. I think it would result in a diminishment of the quality of care in America and would just create an even more powerful government. So I'm very dubious of that. I do think some reforms are necessary, and I believe we can make those. And I don't think there's enough really vibrant competition in the marketplace of healthcare today, and that can help a lot. So I would be troubled by that comment. I'm not sure what he said in the total context, but I would be troubled by that.
Oh, I would not want to see us move into a single-payer system, and I don't think I think most Americans feel exactly the same way. But no, I think that's the wrong way to go, and I think they're in a losing fight as it relates to that.
Well, I think we have to look at the entire gamut of what we're doing here. It's kind of all over the board right now, and our staff is examining every different aspect of this, and so we're working to try to help bring a different kind of a policy together, and that's about the only thing to be said right now.
In the early days of the District of Columbia, homeowners would have their own fire company, and you would pay a subscription fee, and if your house caught on fire, a different fire company would come, depending on who it is. But we found that fire prevention was one of the things that when government provided for everyone, it actually got cheaper and better all around. I think healthcare is the same way. It's one of the few things that if the government actually does, it can do cheaper and better than private industry. And there are other areas where government regulation and government direction may not work as well, but this is one of them.
And are there any countries that you think single-payer healthcare systems have worked?
Well, I mean, we're one of the only countries where we don't have a system like that. The United Kingdom, Canada, just about every industrialized democracy has a role of government in healthcare that is far greater than here in the United States. And what we're talking about is government role in the insurance, not government picking your doctor or government-directed hospitals per se, but single payer would be a way that the government could provide insurance for everyone who wants it. And as I understand the Obama plan, people who are happy with their health insurance would still be able to keep whatever coverage they want.
Nicholas Balassi, CNSNews.com, the Capitol.